After I finished my residency at Ohio State University in neurology, then I did an MDA sponsored fellowship for a year there. So that was sort of my first connection to MDA. Then when I started, we were still, the research was basic science research. In other words, working with chemistry, working with cells in a petri dish. Now we're actually working on animals and people. We brought people in to clinic, we evaluated them, we did whatever testing we could, which was really pretty limited then, and said, well, this is what I think you have. We have maybe 18, 20, 25 different kinds of limb-girdle muscular dystrophy. In the last 30 years, genetic testing has become possible. It's been actually possible to show in many of our patients the exact genetic defect that they have. And that has been a huge thing. Certainly a lot of aspects of what I do is really a very sad area to be in. I'm not the kind of person that does it for the congratulations. I do it for the trying to help the clientele, our patients that we have here coming to clinic. You help the patients, you're helping the families that help the patients too. Because they have, these days especially, there's a lot of difficulties that people have getting care, getting services, getting equipment, getting medication. This is one place where we can hopefully bring together the things that they clearly need. ALS patients are so appreciative of having somebody they can come to and tell them about their problems, knowing that the person can't cure the disease, can't fix a lot of things, but sometimes I can do a little thing. It might be a piece of equipment, it might be a medication to reduce saliva production, it might be something for their digestion, but maybe the biggest thing is just that I'll sit there and listen to them for 15 minutes, 20 minutes, and we'll discuss things. Research is expensive. It takes a lot of resources to make sure that you're following all the rules, that you're doing things in a safe way. A lot of the things that are being used to treat patients with don't exist out there in the market. They have to be created in some laboratory. So you really have a huge number of people. It's very expensive. So that's basically where a lot of that money goes, is supporting that massive effort. They're not a bitter group of people that are angry at somebody for giving them this disease, or they're certainly not wishing it on anybody else. They realize that everybody that has this didn't choose to have it or anything. So in that sense, I guess it's a population I can work with.